Okay, welcome to our March, I almost said February committee meeting, but this is for March. Today is March 5th, 2026. And the agenda was with everyone via the invite. If you didn't get the agenda, I would be more than happy to share that following the meeting. We shouldn't be here long today. It's just pretty brief, but uh, I don't think we have any new faces in the room, so we'll move forward to committee updates. So whomever would like to start with that, please feel free to do so.
Yeah.
Can you all hear me fine?
Can you hear us in here?
Yes, I can hear you.
Okay. I just want to give an update in regards to the rate increase that RSA recently implemented, effective March 1st. We increased the rates by 25%, for employment service provider rates. This adjustment was informed in part of feedback received from providers through the RSA PCO Sustainability Work Group, particularly regarding rate adequacy, provider sustainability, and alignment with regional practices. This increase applies to a range of job placement, supported employment, job readiness, and coaching services, and is intended to provide near-term stabilization for the provider network, while RSA continues to broaden work towards long-term rate modernization. We have put out a solicitation for a consultant to do the long-term rate adjustment. So we're working through that, but this 25% is just an interim adjustment until we figure out long-term wise what we're doing.
Thank you. Any other updates from our committees?
Oh, I can share the one about our comprehensive needs assessment. This is a needs assessment that is done every 3 years. And we just got the contract in place with Promisa, and I'll be the point person to help with coordination between us and our contractor. So we're going to start that ASAP, but it's a great way for this third party to survey different groups of our clients, and so that we can get more information about how we're doing, the services that we're providing, the outreach that we are giving, and get a report after that. So I think it's about a 6-month process, just the collection of data. And then it's probably another, few months for the analysis, and then the report development.
Yeah. Hi, this is Susan, Chair of the Consumer and Advocacy Committee. That's good to know because what we've been working towards is creating surveys and doing data collection. So it would be really great if we could also maybe have some time to talk to whomever is doing that needs assessment. We finalized a survey that we just this past week. We met on the 19th of February and we met on Tuesday of this week, finalizing a survey that is meant to be distributed at the completion of the IPE to get feedback on the process from folks receiving services. And we are currently working on hopefully getting scheduled to be a part of the next all hands RSA meeting, because we will need the assistance of counselors and other folks to encourage people to participate in some of these surveys. So if there's going to be a bigger one that's kind of crossing over some of the work that we've been doing or are doing, it'd be great if we could kind of be involved in that as well. And so, yeah, we're hoping to get our piece out in the next 30 days. And we're looking forward to getting some good responses back and some good feedback.
Good morning. This is Deborah Russell. Can everyone hear me?
Yes.
Yes. And let me start by apologizing. I have not been very present at these council meetings. I have gone through a significant health issue over the past year, and so I've been sort of in and out. So I apologize if what I'm going to ask is something that's already been discussed, but you were talking about surveys, and I sit in a couple of different meetings where what has come up over and over again, particularly on the part of residents that are receiving those services, is that it is evident that one of the issues also has to do with the case managers or workforce professionals or frontline workers, whatever title you want to give, and the lack of training around things like knowing where resources are available in the district, um, being able to co-enroll them in other opportunities that they can take advantage of, where there might be training opportunities, where there might be additional supportive services, those kinds of things. And so the WIC has been engaged in talking about how we can do a better job of doing basically system level training for all workforce professionals, upskilling them on a wide variety of things. And it would be great to get feedback from customers, a cross section of customers, in terms of their experiences in working with the workforce system. This is not punitive. A lot of times there's high turnover and new people coming in that may not know. So how do we do a better job at the WIC in making sure that the workforce system has the best workforce professionals because they have all of the tools that are needed. So if there's anything in any of those surveys that could maybe address some of that, that could be really informative for us as well. And also making sure that we are appropriately serving this population because the people who they are working with understand the population, the resources that are available, who to contact based on what their needs are, because they're coming into multiple doors, not just the DDS door. Thank you.
I would just like to add something to that, just as you're talking, and I'm thinking as you're talking, maybe possibly the WIC could host a summit to bring those together that are within the workforce system. So that way we can learn, what other agencies are doing, outside of what we know on paper. And just giving people a chance to collaborate and putting faces to names, because I can say personally, reaching out to individuals at other agencies, sometimes it's just no response.
Yes.
It's no communication. We're not typically working as one in the district. Everyone seems to be working in silo and focusing on what their agency does and not thinking about how to connect residents to other agencies and other programs that are beneficial to them.
So I wish I had my camera on because you're making me smile. September 25th, the WIC is hosting a DC Workforce Summit at MLK Library for exactly what you're talking about. We would have done one last year, but unfortunately the budget did not allow. So more information will be coming out. We'll be reaching out to all of our agency partners to also get your input on what kind of, what would you like to learn as well. during that time that we're together. So more to come. I will definitely inform this group uh, about timing as we begin to plan sort of what the sessions will be and that sort of thing. But for now, yes, please put on your calendar September 25th, MLK Library, all day.
Okay.
Okay.
And I'm definitely interested in helping you to develop that or assisting where it's needed with that.
Awesome. Awesome. I will be putting together a cross-section team to meet for a few hours to get everyone's feedback. I want this to be useful for everyone. And so I'm going to need everybody's best brains in helping us put that together. So thank you for that.
And Deborah, our the survey that we're putting together is a pretty quick survey, under 10 questions, right? We want people to, it's not super in depth. We want people to feel
Sure.
like they can easily fill it out. But one of our questions is around asking people about barriers to accessing, for employment.
Uh-huh.
And one of the answers that we've chosen, which isn't necessarily related to RSA, it's just to gather information, is difficulty in accessing other community
Yeah.
resources,
Yeah.
such
Yeah.
as, you know, healthcare resources, food security resources, and things like that. So we will have somewhat of a question that might gauge your interest in that very small, very quick survey.
Awesome. Actually, that would be extremely helpful. So yes, once you've received the feedback, any intel that you can give us, would be great. Thanks for that.
Thank you, Deborah. And I know Chloe is not here today. She had another engagement. Susan or Lucas, are you providing the update for the policy committee?
I am not on the policy committee.
You're just
So I've
on
got
so
a
many. I'm sorry.
not at all.
Thank you.
Yeah, I've got a couple notes here. And then Rachel, is Rachel there?
Mhm. Yes, I'm here.
Okay, all right. That's what I thought I saw you, and then I saw Brittany. So correct me if I'm wrong here, but for the Policy and Procedure Committee, um, we're currently reviewing the policy and procedure on internal controls and obligations and expenditures. We've been meeting regularly to obtain updates, and Rachel did a great job writing that. It's very lengthy and very informative. Um, and we're looking to be ready to approve the procedure, but we're looking for a little bit more additional context from internal stakeholders, such as operations, to make sure that we have a full grasp of the context before we submit that. So we'll have another meeting in a couple weeks here to address that.
Okay, and I think this is more related to some of the questions regarding maybe like I think it was maybe like front loading like the PO from fiscal year to fiscal year. Was that one of the questions?
Yes.
Yeah.
Okay, and you guys did, I know I responded, but I don't know where it stopped after I responded to that.
I need to talk to Antoinette. That's it.
Okay, okay, sounds good then. Okay. If you need help with that or just kind of trying, getting the answer or whatever you may be looking for, just let me know and I'll be happy to assist.
Thank you.
Miss Allison, do you have an update from your committee?
Hi, everybody. This is Allison White with the DD Council and chair of the nominating committee. We have not met, so I don't have an update. I was out for about 6 weeks, and I think missed the emails. Maybe please, I think from Charlisa to set a date for something. So I apologize for that, and I haven't come back to it. I think last I checked, though, there was maybe only one vacancy. I'll come back to it and see, but I think we're in an okay place, and I know that MOTA, the Mayor's Office on Talent and Appointments, from some other work that we do with them, that they are delayed on making appointments that are not related to council commissions. I don't totally understand it, but I know there are some other barriers going on there right now. But I'll connect back with Charlisa and with the nominating committee to reconnect on all this.
I think for nominations, we're just meeting right now, a silk representative. As George is no longer passed away. But I think that we could hopefully meet so we can strategize on how to do that.
Got it. That makes sense. I could also, in the meantime, reach out to Robin, who's on the silk, and see.
We can talk later, but I think she had a procedure and she wants to wait a second before she jumps into another commitment.
Sure. That makes sense. I can see if she has other ideas of folks.
Yeah, talking over some ideas would be great.
Sounds good.
Okay, thank you. And Deborah, I hope you don't mind if I just kind of jump in here regarding our email that we had and that you sent to me today. But if there's anybody that is on the committee who would like to be the chair of our media and outreach committee, please do let me know. You can send me an email so that we can get things rolling on that committee. But yes, you can, if you're interested, I can talk to you kind of offline about the roles and the responsibilities of it, as well as what that committee is working towards achieving. And hopefully, again, we'll get that moving shortly. Okay, and then Rachel gave us an update for the PCO work group discussion. That is the work group that we've been working with to discuss the provider or the the increase in provider rates. And so I'll move over that portion of the agenda and go to the director's update. So Dr. Austin, if you would like to give your update, we'd be happy to hear from you. You're on mute.
Can you guys hear me now? Okay. Just recently had the VR Technical Assistance Center come out at the end of January. I think I told you that they were coming the last time we met, but they came. We had a very good turnout with quality management. With that being said, we covered so many different topics. It was very comprehensive. They have a VR wellness survey that they have, and we're still working. We're going to be working through that as an agency, but they brought in a team of 3, and they have several experts in different areas, everything from organizational structure to pre-employment transition services, quality assurance. So we were able to kind of talk through some of the things that we thought were priorities within the agency and that we wanted to focus on this next year with them. It went very well. We probably had about 25 to 28 folks that were here on staff with RSA to be present. And it gave us the ability to kind of work across units and really look at the agency as a whole to see where we could begin to address any gaps, if there's any things that we can strengthen, anything that we need to improve upon, things that we could enhance within the agency. So it was just a really good turnout, and they gave us a wealth of information. With that meeting, they gave us a lot of resources from the national level that we were able to kind of connect with, communities of practice, and different things that are going on so that we can get connected in. So that was very helpful. We survived. I want to say survived because this was my first performance hearing, but we survived as an agency through the performance hearings. It went very well. We were able to address a lot of things that we are doing as an agency and just give really a good rounded update on what's going on within DDS. And Andrew Reese read his testimony, and we were able to give some level of insight from the other deputies that sat with him. But it went very well, and I think we were able to answer questions that people may have had or just clarify where we could. So that went very well. We also recently elected the Randolph Shepherd Blind Vendor Committee. There's like a 2-year cycle, maybe 3 years, 26, 27, 28. Every 2 years, we elect 7 to the committee. We recently swore in 7 vendors to the BVC. I'm so excited about that. We had the ability to meet with them last month and meet with some of the vendors at large. And they broke down different committees that they wanted to address. And we're looking to really refresh or just strengthen our partnership with them so that we can work through some policies that we want to update and just really talk through some of the things we would like to see in the program to make it very strong and vibrant and be really a beacon for other Randall Shepherd programs in the United States. So excited about that. We continue to hire. I'll probably give an update on names next time. But like we have so many different committees going on from VRCs to employment specialists. We just hired a new one. We have specialists that we're hiring. And like I said, I will probably have a more detailed list because there's so many committees that are being put together for various positions within the agency. But we're just excited since there's been a freeze or a hold on hiring that we're able to move forward to really stretch our capacity as a staff to onboard new people within the agency. We, as you guys know, we have a software system, case management system with Libra. We had converted from 7 to Inform, and they're going to be coming here this month because it is March to just do some intensive training to kind of help us because there's been steadily as we rolled out the new system and migrated to the new system, there has been continuous upgrades and enhances to the system. So we're hoping as they come out that we get up to speed and continue to learn what the system does. And we're looking forward to that training. And then they're planning on taking some of that training and working with those of our JAWS users during that training. So we're excited about that. We just recently received the NEON grant. RSA has had that grant, I want to say, for 3 years. I think so. 3 years prior to this. So we were able, and this year it was going to be focused on dual diagnosis and retention. So we had our first meeting this week, and hopefully I'll have more updates, but we did receive it. And with this grant, we're able to get 550 hours of technical assistance. So as we are partnering with multiple district agencies, we're hoping that we can create a policy and kind of come together to really support district residents that have dual diagnosis and do some level of retention services and employment and support the employers in the district. That is my last update.
Well, sounds good and exciting. Thank you. And moving along, are there any other updates, maybe from any of the providers or participants or other committee members? This would be a good time to share those updates. And not necessarily updates, but if there are any questions regarding any of the information that we discussed today or upcoming information.
Hi, this is Allison with the DD Council, and not really an update, but I wanted to say I was excited to hear from you, Ms. Russell, about the workforce summit in late September. Something that we've done the last few years is have an employment first summit in October, and I'm wondering if there's some way to just support you on the workforce summit, or throw our support behind that in some way, or stay in touch and collaborate on the Employment First Summit as well. We, as of right now, I think are still planning on having the Employment First Summit in October, but there's still some questions up in the air. So I just wanted to throw that out there, that that's something that the DD Council, along with many partners, including DDS, have done the last few years. And it's always kind of a question in my mind, how can we best support Employment First efforts? And having a summit and bringing people together is one of the ways we can do that. There could be other things that we do, and maybe collaborating on the Workforce Summit could be part of that as well. So just wanted to throw that out there. And Deborah, I'll be reaching out to you with my Employment First lead, Kevin Wright, and see if we can connect more on making sure we're supporting the WIC efforts also.
I'd be happy to. Both ends. I'd love to hear any thoughts that you have. I'd love to hear about sort of the summit and what you do there. So yeah, please reach out, and we can set up a time to talk in more depth.
Awesome, will do. Thank you.
My pleasure.
Anything else? All right, if nothing else, I think we can adjourn for today. Thank you guys for attending. We'll make sure that this does get uploaded, or the recording does get uploaded for those that would like to go back and review. And please continue to meet with your committee members. Again, if you're interested in becoming a chairperson for the media committee, just shoot me an email, or you can also email Charlisa, and she'll share that information with me. And if there's nothing further, we will
I have one question. This is Riola. The lady who spoke with the tan jacket, beige jacket, what is your name again, please?
Dr. Shannon Austin.
Okay, Dr. Austin, thank you so much.
Mhm.
It was very, very good presentation. Thank you.
Thank you.
Riola, you may not have been here when Dr. Austin was introduced, but she is actually our deputy director, so RSA's deputy director. And that's probably why you didn't know her.
Oh,
This is probably,
okay.
I believe this is her second meeting with us.
Oh, okay.
So, but yes, she's here.
Okay, thank you.
Thank you.
You're awesome. Thank you for making me aware of that. Thank you.
No worries, no worries. All right. Okay, I'll see everybody. I guess it will be May. So we'll move right into the springtime. I'll see you guys then. Thank you.
Thank you. Great meeting. Thank you.
Thank you.
Thanks, everyone.
Bye.